Where can those in Suffolk County who struggle with nicotine addiction get the help they need to quit? And Dr. Max Banilivy joins us to discuss the topic of suicide prevention.
We know for a fact that asking people directly about suicide actually helps. So I think people to help themselves get more comfortable with asking directly when they're worried about someone.
And we revisit the segment on the Northport Veterans Hospital. Hello, I'm Art Flesher from Suffolk County Health Department's Division of Community Mental Hygiene. I'm your host for Something of Substance, our monthly video magazine. Welcome back. Each month we show how substance abuse, mental illness, and developmental delays affect you, your kids, and your community. We'll also give you a few examples of how services in Suffolk County help people find the inner resources they need to tackle their problems.
I had no idea it was going to be so hard. I didn't know what to expect. You hear the stories, but I never took any of it seriously until I found myself here. And then I realized I was going to have to work hard for my recovery.
If you or someone you know has a drug or alcohol problem, you are not alone.
Recovery was the hardest job I ever had, and the most important.
Tobacco use is the #1 preventable cause of death and disease in this country. Suffolk County has been at the forefront in proposing and supporting proactive regulation of tobacco products and their use. We recently visited the Department of Health Services Office of Health Education to get a better perspective on their efforts to assist in the prevention and cessation of tobacco use.
Well, the Department of Health Services has been on the forefront of tobacco control since as long as I've worked here, which has been a very long time. Suffolk County has a very long history of good tobacco regulations that protect the health of all residents.
We're the Tobacco Enforcement Unit. We're part of the Suffolk County Department of Health. There's 4 inspectors. We go out and enforce the New York State Adolescent Tobacco Use Prevention Act. It's a law New York State wrote to prevent the sale of tobacco products to minors.
Well, tobacco use is way down, especially when you look at the percentage of adults that smoked in the 1950s and 60s was more than 50%. Now, smoking among adults is probably just below 20% nationwide and probably around 12 or 13% in Suffolk County.
Health Smart is a comprehensive health education curriculum, and the curriculum begins in kindergarten, and each grade, first grade, second grade, all the way up. On a secondary level, there's a middle school curriculum, and on the high school level, high school curriculum. On a secondary level, it's taught by certified health education teachers. On an elementary level, it's taught by the classroom teachers. Health education is mandated in New York State.
Since the year 2000, we've been providing tobacco cessation programs for the residents of this county. And we follow the clinical practice guidelines that are put out by the U.S. Public Health Services. We run classes. We educate people about the best ways to quit smoking, about what tobacco really does to them. We provide pharmaceuticals to individuals that are interested in taking the medications that will help them quit smoking.
Well, our cessation program has been in existence since June of 2000, and I've been with the program ever since its beginning. We have a 6-week program. Actually, it's 7 weeks because we have 6 consecutive 1-hour sessions, and then 3 or 4 weeks after the last class, we have a reunion. The classes are conducted by health educators, public health educators, and during the class time, we encourage people to make a quit plan.
Tobacco use is the #1 preventable cause of death and disease in this country. Approximately 500,000 people die every year as a result of either their own smoking or being exposed to secondhand smoke. That's more than 1,200 people a day. So everybody knows someone that's been affected by tobacco smoke, either by their own smoking or being subjected to someone else's smoke.
we hire minors to work for us and conduct stings to enforce the law. We have our minors go out and make purchase attempts in stores throughout Suffolk County. If they're successful in making that purchase from a store, we have to issue violations to those stores that sell the tobacco products to the minors.
There are so many influences on kids to start smoking. The tobacco industry, despite all of the claims that they make and all the promises they made in the Master Settlement Agreement, market very heavily to kids. And now, especially with the alternate forms of tobacco, we see rises in kids using smokeless tobacco, the new products such as the e-cigarettes. All these products are very troubling to us, and they're very dangerous, and they're nothing more than nicotine delivery devices. And the tobacco industry knows that once they get the kids hooked on nicotine, that they're lifelong smokers, and they'll buy all of their products, cigarettes included.
In regard to tobacco, just taking that topic or tobacco prevention curriculum, taking that out, what the Center for Disease Control has said to do is you don't just focus on one topic when you're dealing with health education, especially young people. You deal with comprehensive health education. So we're not just talking about, well, the bad effects of tobacco use are. It's about self-esteem. It's about learning how to communicate your feelings. It's learning, not just learning the topic and the harmful effects, but also developing the skills, developing a norm in each classroom of being able to resist those high-risk behaviors, whether it's tobacco initiation in 3rd grade or in high school or middle school. It's all about knowledge, skills, and practicing to build a norm of healthy behaviors. As far as tobacco use and initiation, that is down in Suffolk County.
We have about 1,700 tobacco retailers in Suffolk County that we have to check, and we have to check all of them at least once a year. We have to visit them and have a minor that's hired by us make a purchase attempt, and that's how we enforce the law.
It's very difficult to quit on your own, and that's why we run the programs that we do. People that quit cold turkey has a very low success rate. It's important to be part of an educational program and a support group that the department runs, and use the medications that have been shown to be effective in helping people quit.
I have some examples here of some of the products that were purchased by our minors in the past. One of them is an electronic cigarette. You have your regular standard type of cigarettes. And also, believe it or not, rolling papers are also considered to be a tobacco product, so you can't sell rolling papers to minors either.
Direct health care costs as a result of tobacco-caused diseases cost this country $96 billion a year. And that does not even take into account lost productivity because people can't work because they smoke, accidents with cigarettes that cause fires, or additional cleanup that businesses have to use because people have been smoking in them. So more than the direct healthcare costs, smoking costs this country much more than that.
We'd like to thank the staff from the Department of Health Services Office of Health Education for their educational efforts. For more information about quitting smoking and the tobacco cessation programs, please call area code 631-853-4017 or visit the website at www.suffolkcountiny.gov/health. Up next, we have an interview with Dr. Max Banilivy from the Pedersen Craig Center to discuss the topic of suicide prevention. We'll be right back.
They'll be fine, I hope.
What if you could prevent a young person from getting hurt or killed?
What should I do?
If you could turn back the clock and stop an underage drinking party from ever happening. Now you can. Pick up the phone and call 1-866-UNDER-21. It's your community, your call, and it's completely anonymous.
Suicide prevention is a paramount concern in Suffolk County. Dr. Max Banilivy is a clinical psychologist at the Pedersen Craig Center and is a member of the Executive Committee of Suicide Prevention Coalition of Long Island. He joins us today to talk about suicide prevention. Thank you, Dr. Banilivy, for joining us today.
Thank you for having me.
Dr. Banilivy, the need for suicide prevention is obvious. Can you give us some basic statistics on suicide, please?
About more than 38,000 Americans take their lives by suicide nationally that we know of. About at the New York State level is about 1,300, and locally in terms of Long Island there's less than about 190 or so people that, as of last CDC statistics, that we know that would take their lives by suicide, but we also know that that's a gross underestimation.
Okay. And I gather with returning veterans and all the attention to suicide among returning veterans, that's contributing as well.
That is definitely contributing, and certainly the economy is contributing. So those are two of the main contributors to a rise and increase in terms of, and I'm sure the community hears about that or finds out about those suicides, and certainly with regard to the veterans, that has been very public.
Yes, yes. And I know that on Long Island we have a suicide coalition that you're understandably very proud of. Can you talk about the membership of the coalition and what the main goals are?
The goal that we started the coalition number of years ago. It was to serve as a way of getting the community together in Nassau and Suffolk County as a bi-county region, and in that context, continue to generate ideas, needs for the community, and develop subcommittees for youth, for certain stakeholders, and so on, to go forward. Disseminate information to the community about what we're doing, what are the things that are available, what kind of trainings, what kind of education, where to go for resources, and so on, but benefit from pulling in more and more community members to being part of the coalition to continue to meet that goal.
So the coalition really looks to grow and involve as many people as possible.
Absolutely.
And entities.
Absolutely.
Now I know there are member organizations. Are there any programs in particular that you think are particularly innovative or something that people would benefit from knowing about?
Well, programs, I guess one of the things that we have established has been the website.
Mm-hmm.
That is really was because that is a context where a lot of information, a lot of resources, there's a lot of education. So we, as a living document, we meant that to be an evolving document where people can interface with, give us feedback, and benefit from what is there already. So we would like that to be utilized as much as possible. And there's a counterpart of that at New York State level. I'm going to mention both of those websites. For the website for Long Island region is preventsuicideli.org, and the one for New York State is preventsuicideny.org. About 3 years ago or so, New York State established a suicide prevention center as a result of a summit that's established, and that they have been at the forefront of rolling out many resources, many educational things, many events and programs statewide.
And I know that one of the member agencies, Family Service League, has a project known as Joe's Project.
Right.
Can you talk about that a little bit?
It's a wonderful program, and just actually is easily accessible, and it's available through Family Service League, and it's a 24/7 type availability for anyone who may have concerns about suicide, or any survivors that may be concerned with any question. They can contact Joe's Project directly, or that they can go back to the website, and then they can still get some of that information. Plus, the American Foundation Suicide Prevention chapter on Long Island, afsp.org, is a website that absolutely to go to, particularly for survivors.
Mm-hmm. And I know that it's been your feeling, as well as the members of the coalition, that to help prevent suicide, you don't have to necessarily be a professional. You just have to be a person that's aware and that talks about these things and asks questions. Can you talk about how a viewer might be able to see themselves as suicide alert and what that means?
I think just getting some of that information, the first step is for them to go to the website, just learn, just on their own, at their leisure. The second is to benefit from some of the we call gatekeeper, community-based educational trainings that are available at this point that we can roll out anywhere. All they have to do is contact through the website, and that would be another way where they would find out that indeed you don't have to be a professional, they have to just have an interest, have a passion, have a willingness to wanting to learn some basic things and to shed the myths about suicide and suicide prevention and about people who think about suicide. And I think those are good starting points.
And what would be your thoughts if somebody is at all concerned about somebody? Should they talk about it? Should they ask questions? Or would that somehow encourage suicide?
Right. I think that's, we know that has been a long-standing myth and still is. We know that, and we work very hard at trying to shed that myth and by education, letting people know. We know for a fact that asking people directly about suicide actually helps. So I think people to help themselves get more comfortable with asking directly when they're worried about someone. When we do, and when I do some of the trainings, and I'll ask the audience all the time, think about somebody who is in your life that is going through a lot of stress. Do you know if that person has thought about suicide? And most people say no. And the reason is, well, I haven't asked, because that's an awkward thing to be asking about a serious matter.
Yeah. Okay, well, thank you very much. You mentioned the website for the coalition. Is there a phone number also in case somebody's more comfortable with that they might be able to call?
Absolutely. They can call. My number is 631-920-8039. They can call that number. And so also there are many resources at the Long Island Field office. I think that number is 761-2508, the main number there. Those numbers are also the mental health associations, particularly the Mental Health Association in Suffolk County. Colleen Merlo is the executive director. She's a tremendous resource. I don't remember the telephone number offhand, but it would be easily found. I think those three entities will be able to respond very quickly, usually.
Thank you so much for joining us today.
My pleasure. Thank you.
Thank you. We'd like to thank Dr. Max Banilivy for sharing his expertise and his continuing efforts to raise awareness about suicide prevention. Up next, we have an archive segment on the Northport VA Hospital. Stay tuned.
Are you feeling down or anxious? Perhaps you've suffered a loss recently, or you're involved in a difficult relationship. Maybe you need food, shelter, help with financial problems, or just someone to listen. Whatever your concern, you'll find a caring, accepting person when you call Response. Their volunteers will give you all the time and information you need, night or day. Call 751-7500. It's anonymous and confidential.
The Northport VA Hospital serves thousands of veterans here on Long Island through an array of medical, social, and mental health services. The VA Hospital is committed to delivering services geared toward eliminating veteran homelessness, improving veterans' mental health, and enhancing veterans' experience and access to health care.
Hi, I'm Joe Sledge. I'm the Public Affairs Officer at the Northport VA Medical Center and a proud U.S. Army veteran. This is the Northport VA, and we're here for Long Island veterans. We at the Northport VA Medical Center are here for one reason only, and that is to serve the needs of Long Island's veteran population. Most honorably discharged veterans on Long Island can receive care and services at the Northport VA Medical Center and at our various community-based outpatient clinics, Riverhead, East Meadow, Patchogue, Valley Stream, and coming soon, Bayshore. So when veterans come to Northport VA Medical Center, they want to come to the eligibility and registration section, where they'll complete a brief application for VA healthcare benefits. At that point, the staff will enter the information into the computer, and VA can determine eligibility for VA healthcare services. So here we are at Northport VA Medical Center's ER registration and admissions area. This is basically the location where veterans who are going through crisis, whether it be medical or mental health, would come for support. They would meet with a nurse, be triaged, then be seen by a doctor, assessed, and the appropriate level of care, whether it be an admission to the hospital's unit or to an outpatient clinic, is provided. And of course, this is a 24/7 operation, so any time of the day or night, veterans can get services at the Northport VA. The Vietnam Veterans Memorial Garden is a gift from the Vietnam Veterans of America of Suffolk County, Chapter 11, and their friends and partners. It began with really an idea to pay tribute to one veteran, and then it expanded to this beautiful setting where all veterans, both living and deceased, are honored. And the way in which we honor those veterans is we have ceremonies here throughout the year, and there are also many, many opportunities for quiet reflection and a tremendous amount of healing that takes place in this garden. This is where we come to remember the service and sacrifice of all of our nation's veterans. So loved ones who are interested in individually honoring a loved one who served in active military service can actually purchase a brick through the Vietnam Veterans of America and have an inscription on that brick to singularly honor the individual service. This is our historic little white chapel here at Northport VA Medical Center. It's here for all veterans of all faiths. It's actually a gift 62 years ago from the readers of the Journal American, which was owned by the Hearst Foundation. You know, nobody goes to war and comes back unaffected by that experience. Here at the Northport VA Medical Center and in our community clinics, we have the programs and services to help veterans make that adjustment from military to civilian life.
One of our central missions is to be available to assist our veterans and their families with their mental health needs. At the Northport VA, we have a comprehensive continuum of care providing mental health services to our veterans and their families. This starts with veterans who may need an inpatient hospitalization. We have a 41-bed psychiatric unit. Then we have a full complement of outpatient programs to help veterans with their mental health issues. This includes also substance abuse treatment. We have 2 specialized residential treatment programs for veterans with substance abuse needs, one of which includes our PTSD program and the outpatient program. With the current war, we have a specialized program to assist our returning veterans who are having significant readjustment issues, from what we call battle mind, where you are prepared to be combat ready to come back to civilian life. We are noticing that due to multiple deployments, this is causing a significant disruption in family life. Veterans are struggling with substance abuse and mental health issues upon their return and having difficulty sustaining or obtaining gainful employment. Through the full array of our mental health services, to include PTSD and substance abuse, we're able to help these veterans readjust to community living and pursue their lives upon return from war. Homelessness is a big issue on Long Island, as it is around the country, and many of you may know that the President, through the Secretary, has launched a plan to end veteran homelessness in 5 years. We have a large homeless services program here that begins with a transitional residence on our campus for veterans who actually walk into the VA and are homeless, and then we're able to assist them with transitional and permanent housing in the community. This ability to stabilize veterans has significantly ameliorated their need to get involved with substance abuse and or struggle with mental health issues. The more we're able to help our veterans successfully live in the community really helps them really get their lives back together and move forward.
I supervise all the social workers that work in mental health, both inpatient and outpatient. As John previously talked about, we have a multitude of services available to veterans, both in substance abuse. My particular specialty is trauma work. I work with combat trauma veterans and veterans who were sexually assaulted in the military. I think the takeaway message from all of this is that we can help you, but you have to show up here first. Once you're here, we are very good at what we do, and we are able to give veterans back a life they may have lost and sometimes we can give veterans a life they never had in the first place. We do various modalities of treatment here, psychotherapy, both individual and group. We find that group can be a very fulfilling experience for a veteran. A lot of veterans are very apprehensive about going into group because they think that their problems are unique. They think that nobody else can understand their problems. And what happens is when they get into group, they realize that their problems aren't unique, that most of the other people in the group have been through the same issues. No matter how difficult or shame-based or embarrassing those issues may be, somebody else has had those issues. The support they get from their peers, the love that they get from their fellow service members is very healing. Veterans learn to look out for one another. They were trained that way when they were in boot camp. They come back to those values in group therapy. And certainly some individuals need to do a little individual work in order to be ready for group, and we offer that also.
For information about the Northport VA Hospital Services, contact them at area code 631-261-4400. For veterans that are currently homeless or facing homelessness, please contact the National Call Center for Homeless Veterans at area code 877-424-3838. We'd like to thank our viewers for tuning in to Something of Substance. Our video magazine is a public resource, and we're eager to hear your feedback as well as any suggestions you may have for future show topics. For all inquiries and concerns, please contact me at art.flesher@suffolkcountiny.gov. I'm your host, Art Flesher. Join us again next month for more of Something of Substance.